students' emergency seizure medication could come to school in different forms. It could come in a vial with a syringe and a needle and a nasal adapter for the medication to be administered in their nostrils. Or the student's medication could come in a glass vial with a dropper for the medication to be administered buccally or inside their cheek. Additionally, their medication could come in a plastic bottle with an oral syringe for the medication to be administered inside their cheek as well. Or their medication could come in a pre-filled syringe to be administered inside their cheek. It is important for you to discuss this with the school nurse or the student's healthcare provider so that you understand how the medication should be administered.
Given that when a child is having a seizure, it can be a stressful situation, it is highly recommended that you familiarize yourself with that child's seizure emergency care plan beforehand. Store the seizure emergency plan in a location that is easily accessible during a seizure. Be sure to check expiration date on the medication bottle or package. Call for assistance if someone else is present. Place the child on a flat surface, such as the floor, being sure not to move the child any more than is necessary. Turn the child onto their side to allow vomit or phlegm to be expelled rather than inhaled. Place something soft under the child's head to protect them from injury. Ensure the child's airway is not obstructed. Loosen tight clothing around the child's neck. Do not restrict the child's arms or legs. Ensure there is no furniture or objects close to the child that could injure them. Review the child's seizure emergency action plan. Gather the emergency medication and needed supplies in case the seizure lasts longer than the designated time frame. If possible, wash your hands. Assemble the needed supplies. Put on gloves. Check the bottle of medication to ensure that it is, for the right child, the right medication, the right dose, being given at the right time, being given by the right route, and not expired. Ensure the appropriate amount of time has passed prior to administering the student's seizure medication. If there is another adult present, have them call 911 or EMS as you administer the medication. Open the bottle of medication. Place the syringe or dropper into the bottle of medication until the end is in the fluid. Draw up the correct dose of medication, ensuring that the dose is correct once the syringe or dropper is removed. If the dose is incorrect, the fluid can be squirted back into the bottle and withdrawn again. Retract the child's lower lip and slowly squirt the drug into the mouth between the lower lip and gum. Squirt half of the medication into one side of their mouth and the remaining medication into the other side of the mouth. Take care not to spill the drug outside the oral cavity. Take care not to squirt the medication onto the tongue or into the open throat of the child. Do not place the syringe or dropper between their teeth as they may bite it. There is no need to open the child's jaw as the medicine does not need to be swallowed. After squirting the medication into the gum, remove the syringe or dropper, but keep the lip retracted for a few seconds. Use gauze swabs to wipe their mouth after. Remove gloves. If 911 has not been called yet, call 911 or EMS services. Stay with the child, monitoring breathing. If breathing stops, begin rescue breaths. If breathing and heartbeat stop, begin CPR. Once rescue squad arrives, inform them of medication administered, including type of medication, dose, and time. Remember to dispose of all used equipment and bottles of medicine safely out of the reach of children. Wash hands. Document the date, time, and dose of medication given, in addition to what was observed during the seizure. Follow up with the parent or guardian and healthcare provider as needed.